So then we will move on to the afternoon presentation. First presentation already done, no? And the second presentation, Dr. Tomasz Dinda from Medical University of Warsaw, Poland. The topic is, does pregnancy influence eye parameter? Assessment of choroidal thickness using EDI OCT before and after labor, depending on the way of delivery method. Dr. Thomas, yes, you can go ahead.
My name is Tomasz Dinda. I'm representing here the Department of the Neonatology from Medical University of Warsaw and Department of Ophthalmology, also from Medical University of Warsaw. I would like to present the results of our study, and as shown, it is the second part of the study which I conducted with my colleague Karol Tardaj that you have heard before earlier. A little bit background why we are interested in ophthalmological parameters during pregnancy. It's because up to 15% of women reports deterioration in visual acuity during pregnancy. Sometimes they need additional correction during pregnancy, but in most cases after delivery, the visual acuity come to the point before the pregnancy, so those spectacles are not needed more. So we are interested what parameters are changing during pregnancy and after labor. So the aim of this part of the study was to assess the morphology of the choroid tissue with use of enhanced depth imaging optical coherence tomography. Choroid tissue is this red tissue as shown here between the retina and the sclera of the eye. The choroid give oxygen and nutrition to the outer layers of retina, and it is very hard to visualize this tissue. It was possible 15 years ago when the optical coherence tomography was introduced. Since then, we can visualize this tissue. And the problem is that the retinal pigment epithelium, which is one of the layers of the retina, act as a blockage for light to pass through. So it was hard before introducing the OCT to visualize this tissue. So the choroid is the tissue that is not, that's its physiology, it's not fully known up to date. So the material was 90 eyes. The women were assessed twice during the third trimester of the pregnancy and then during the 6th week after labor. We choose this time, the 6th week after labor, because at this time it seems that all changes that came during pregnancy are going back to the level from the period before pregnancy. Our inclusion and exclusion criteria, as shown here, we excluded from the study the women with eye diseases, with a history of ophthalmological surgeries, with multiple pregnancies and other complications, also with big refractive error greater than 4 diopters. We make that exclusion criteria to make our study group as homogenic as it could be. So here you can see the images that we obtained. Those are the images from ADI OCT. Here is the apparatus. So here you can see on this, maybe we will go here, bigger picture. On this slide you can see the fovea, the retina, with every layer of the retina can be shown here. And behind the retina, here you can see the choroid. Choroid contains many blood vessels that are giving oxygen and nutrition to the outer layers of retina, as I said before. After obtaining those images, we were measuring the thickness of the choroid. So it is this size here, the thickness of this tissue. Unfortunately, we don't have a software that will calculate it automatically, so we made it we made it independent by 2 researchers and then give to the statistical analysis the mean value of the thickness. We measured the thickness of the choroid in 9 different spots. In subvalve region here, and 4 spots both temporally and here nasally. Here you can see the optic nerve. We made 9 measurements in exact those places because in literature, in medical databases, there are also a small number of similar researches, and to make good comparison to the results obtained by other researchers, we choose the similar points of measurements. Going to the results, here you can see in the table the results within the group of women after cesarean section, after C-section. So the general trend before comparing before and after delivery measurements, the choroid is thinner before delivery in comparison to the period after. And the bolded one values are statistically significant. So you can see that in 7 of 9 point of measurements, those results are statistically significant. And to see other group women after natural labor, those trends are the same. So the choroid is thinner before delivery in comparison to the period after delivery, but the statistical significance appear only in 3 of 9 different regions. So here one more results after cesarean section, and here after natural labor. So going to conclusions. Overall, the thickness of the choroid is thinner in 3rd period of pregnancy in comparison to the period after delivery. Those women, those changes are particularly noticeable within the group after C-section in comparison to the vaginal delivery. Okay, as I said before, the medical databases, there are also other studies that studied the thickness of the choroid during pregnancy, but those studies included smaller group of patients. So our study is up to date, the biggest study that assessed changes in choroidal thickness during pregnancy. But the trend observed by other researchers trends are similar to our results. So, for example, in this paper, you can see the thickness of the choroid, but during pregnancy. And we can see that in the 3rd trimester, those results are lower in comparison to the parameters before pregnancy. So the overall trend is that during pregnancy the choroid is thinner to the period comparison to the period both before and after pregnancy. What can cause those changes? We think our hypotheses are that the choroid thickness is lower during pregnancy due to the blood flow redistribution to other organs that are important for whole body, especially during pregnancy, such as uterus, kidneys, and other organs. It can be also dependent on increasing of alpha-1 receptors that their activity is higher during pregnancy and cause constrictions of choroid vessels. And our study is just beginning point of other studies that must be conducted to fully know all to fully know every information that are causing the changes that we observe in the study. So thank you for your attention. Thank you.
Okay, thank you. Now time for the discussion.
Hi, I think you all, 3 of you have done a very nice research on your place, but then again for us also something new, that this kind of research for me also is something quite new for us because I have a different background. No, just out of curiosity, I'm just asking because you were saying that the choroid thickness during the pregnancy changes. Would that pregnant woman, would they feel the changes, or do they have any? Did they get any effect on that?
I can go back to the second slide. I have that 15% of pregnant women are reporting deterioration in visual acuity. And as my colleague said before, it can be also the background of those changes can be also the changes in the cornea. So we don't know is it this visual acuity deterioration caused mostly by the changes in the cornea or the changes of the choroid tissue, but I think that it's more by the cornea changes. So the thickness of the cornea, because the cornea have the bigger influence on visual acuity.
Okay. But that can be even further explored to figure out which one is
Yes,
causing.
as I said, the choroid, we still do not know everything about the physiology of the choroid, and it's the subject of the medical studies that are conducted
Okay.
in many parts of the world now.
Thank you. Thank you.
Yeah. Any other questions from the audience? Anything you want to?
Retinal detachment, pseudophobia.
Sorry, can you?
Pseudophobia patient.
Retinal detachment. Retinal detachment can occur during, especially during delivery. That's why the women with high refractive error greater than 6 diopters shouldn't give birth vaginally because of the risk of retinal detachment. But we excluded those women from our study because it's known that the high myopia is the patients with high myopia shouldn't give birth naturally.
Any more questions? Okay, in the absence of questions, thank you very much, Dr. Thomas. Right, we'll move on to the next presentation. The next presentations by Nidusha Turai from School of Science, BMS. The title is Identification of E. coli in drinking water samples in Jaffna area and detection of antibiotic resistance. So, what do you?
Good afternoon, everybody. I'm Nidusha Tavathre from School of Science, Business Management School. I'm here to present my research project on identification of E. coli in drinking water samples in Jaffna, Velgamam West area and detection of its antibiotic resistance. Let's see the background of this project. Globally, every year 1.8 million people and every day 5,000 children affected by diarrheal diseases like cholera and other diarrheal illnesses. So, drinking water samples should be free from pathogenic organisms. In our Jaffna area, especially Velgamam West people doesn't have the enough concern about the drinking water purity. So, I mainly target the drinking water samples from most residential areas and schools and temples. The number of antibiotic resistant E. coli causing infection has increased nowadays. presence of E. coli in the drinking water samples indicate the fecal contamination of the water. If the bacteria get resistance for some antibiotics, that gene get transferred through normal unpathogenic organism in our human gut microbials and get in future we don't any treatment to cure the illness. So we mainly focus the study of antibiotic resistance. Let's see what is the what is antibiotic resistance. Here I mainly target the antibiotics sulfonamide and tetracycline. Let's see the tetracycline mechanism. Normally tetracycline bind with the bacteria the 16S ribosomal subunit and inhibit the DNA synthesis, so protein synthesis. So if the bacteria develop the resistant genes in the plasmid, that plasmid genes produce the some membrane pumps which is called the efflux pump that pump out the antibiotics from the cells inside the cells, so that will help to grow bacteria. And another way, the bacteria cells coated their ribosomal unit and prevent from the antibiotic, or else it produce the antibiotic regulating enzymes. That enzyme will regulate the antibiotic, then the bacteria will grow up. So this how the tetracycline produce the antibiotic resistance. When see the sulfonamide sulfonamide normal inhibit mechanism, it will inhibit the nucleotide nitrogen based purine synthesis, inhibit the purine synthesis which by the binding with the enzyme binding site, competitively binding with the enzyme binding site. So if the bacteria develops the resistance for the antibiotic, that bacteria produce more and more substrate, then the sulfonamide not go and bind with the competitively bind with the substrate, then that pathway will perform, or else it will modify or alter the shape of the enzyme. Then the active site can bind with the substrate, not for bind with sulfonamides. This how the sulfonamide resistance will develop by the bacteria. Normally, resistant genes can be transferred through the Normally, the bacteria develop the antibiotic resistant gene that will transfer through the other bacteria. Vertical evolution, which called vertical evolution, it can happen when the bacteria reproduce. In another way, the horizontal evolution, that means they have three patterns. One is conjugation, that means the transfer bacteria, so the developed gene can transfer with another bacteria, or else the transduction called some virus can transfer the mutated genes, or else the transformation also happen when the bacteria runs with the gene. So let's see the project outline. Here I have the general objective to isolate and identify Escherichia coli in drinking water samples from Valihamam West Jaffna Peninsula to detect Tecte and Tecti and sulforamide that confer the antibiotic resistance. For that, the specific objectives are to analyze water samples physical parameters, to isolate bacteria using membrane filtration and identify E. coli in high chrome agar medium, to morphologically identify bacteria using gram staining and biochemically characterize using indole and citrate test, to extract the DNA and detect the presence of 16S rRNA, UADA and LAC-Y using the molecular technique, to identify antibiotic resistance by disk diffusion techniques and using molecular techniques, TET-A, TET-C and SALVA. For the project, first I collected samples from Valihamam West, selected 10 areas from the resident, as I mentioned earlier, like residential areas and temples, most schools. Then all the samples undergo the physiochemical parameters such as pH, temperatures and chlorine concentration. Then after that, the samples undergo the membrane filtration to 0.45 micrometer nitrocellulose membrane and selectively E. coli cultured in high chrome agar medium. Then the selected colonies for the further study subcultured in a LP broth. From that broth, E. coli was confirmed following the morphological detection of gram staining, biochemical tests such as indole and citrate. Then the DNA extract was done to carry out to further confirm of E. coli, targeting the 16S rRNA, UADA and LAC-Y gene. Then from that selected E. coli culture undergoes the antibiotic test. These are the results which I get for the physiochemical parameters analysis. When I compare when we go through these results, all the parameters are suitable to the growth of, facilitate the growth of E. coli. So we can confirm the E. coli can grow. If it's present, it can grow. Then in the membrane filtration, E. coli normally we use high chrome selective media for the E. coli. For that, we will receive the bluish green colonies if E. coli is present. It happens because of when the beta-glucuronidase activity is present, every E. coli has the beta-glucuronide activity. So if it's present, the bluish color will form. Some serotypes like most of the 97% of the E. coli has the beta-glucuronide activity, but in some case the serotype 0157 H7 do not exhibit beta-glucuronide activity, or else it has the gene but it not express the activities. So in the research I got the colorless colony also. So further confirm the E. coli, we subculture that colonies and further detection was carried out. When in the Valihamam West area, the wells the area is near to sea area, so the water has some salt concentration. Because of that, some bacteria could not grow very well because the osmotic stress, bacteria can burst. And further gram staining also done to confirm the E. coli. Then the biochemical assay we did the indole and citrate test. For the indole and citrate test, we got all positive for the citrate, and some of samples got positive for indole. From that biochemical assay, we further E. coli was confirmed further detection of molecular. For that, we targeting the 16S rRNA, UADA, and likewise through that from that result, according to UADA and likewise gene, we select 5 samples as E. coli positive. Further, that column samples undergo the antibiotic resistance test. For the antibiotic resistance, we 5 colonies selected from school in Chulibram and from the residential area of Mulai and Pannagam, all 5 showed tetracycline and vancomycin resistant, but all sensitive to sulfonamide. Except the Mulai sample, other 4 indicate only TET resistant gene. The presence of coliforms and other pathogenic organisms as well as acquired antibiotic resistant gene could jeopardize the health of community members. This also highlights the number of water quality and multi-drug resistant bacteria in Valigaon West area in Jaffna. These are my references. Thank you.
You can ask question now. Any clarification, any suggestions? No, saying no. Okay, you have said that the E. coli, you have done all the morphological, these biochemical and molecular testing, but in the biochemical test, some of the things is for the indole positive and catalase negative one. So it didn't give all the E. coli that you have screened like the same results, but up to the antibiotic screening, whether you have the same results, any colonies that you have screened, like it has been positive for all the tests.
Yeah.
So up to the last level.
Last level, I got 1 sample for all tests positive for it.
Have you done sequencing? Only the
Only the
specific
station of
the selected gene that you have identified, but you haven't confirmed it. But next level you can confirm it, because still that can be it can show the differences.
In future we can.
Yeah. Out of how many samples that 1 sample is positive?
Out of 10 samples, 5 got UAD and likewise positive for the gene molecular detection. So according to the E. coli, normally they have both beta glucuronide and glycolase activity. So yeah, we assume that it both being present in the detection, we assume that is E. coli, because in first we selected for the culture in a Phytomarga, that is specific for E. coli.
And you have tested only that medium, specific medium. Okay. But anyway, still, but when you do the sequencing, there may be difference. But so if you have some 5 samples or something, then you can go for the sequencing and check that. That's what. Okay. So what is then? What is your recommendation from this?
We have to do more samples, collected from more samples from the areas and all over the area, and further tested samples and get awareness of the people, how to handle the waters and how to avoid.
So initially you have mentioned that it's fecal contamination is possible because E. coli, if it is there.
They don't
So
think about the.
no, have you analyzed what are the samples that you have selected? Well or what?
Well sample. Normally they are almost they are using
Well
well
done.
sample.
Okay, thank you.
Thank you. So our next speaker is Dr. Sulekha from University of Colombo. Her topic is on application of special Ayurvedic concepts in the style regimen of the enhancement of quality of the quality of life and to prevent disease. Very fine. Yeah.
Good afternoon. Application of special Ayurvedic concepts in lifestyle regimens for enhancement of quality of life to prevent diseases. So my aims and objectives are to develop a unique effort of awareness about enhancement of Vyadhishamitra. Vyadhishamitra means immunity. It is the terminology in Ayurveda. So to promote the Ayurvedic preventive measures which are based on adherence to Dinacharya, Sadhuta, Dharaniya Vegya and Acharya Rasaya. And to illustrate the different Ayurvedic techniques to healthy living as it is enhancing the ojas of the individuals. Methodology. Relevant articles and the authentic Ayurveda textbooks are referred in this study to find out the properties of an awareness of community regarding Vyadhishamitra. Illustration of different Ayurvedic techniques for uplifting ojas as mentioned in Samhita Tantras of Ayurveda. And authentic Ayurvedic books reviewed to detect the Dinacharya, Sadhuta, Dharaniya Vegya and Acharya Rasaya. So, concept of health. What do you know about the health? We need, in this, recently we know that health is very psychological concept means nowadays you may know that lot of psychological problems because of this pandemic situation. So social well-being and emotional, psychological, social well-being is very, very important in these days. So psychological concept of also in the health, also included as health. So holistic concept means totally we are total health is an approach of life that considers multi-dimensional aspects of wellness. So it encourages individuals to recognize the whole person: physical, mental, emotional, social, and intellectual and spiritual. So according to WHO, we know that the definition of health is including physical, mental, and social well-being earlier in 1978. Nowadays they revised it with the spiritual concept also. Spiritual health also included. But in Ayurveda it is as I told you earlier, 5,000 years before Ayurveda concept began, so originated. So it is divinely inspired. So it is very big concept, and health is it is not a simple thing. It is widely described. It is called as Samadosha, Samakanicha, Samadhatu Malakriya, Prasannaatmekriya Manas, Swasthamitya Vidiyate. These are everything written in slokas. It is Sanskrit slokas, so but when we analyze it, it is everything included, even physical, mental, emotional, social, and spiritual well-being is inside this definition. So it is very big concept. So in Ayurveda, health is very, very important. Not according to Darshana, but everyone knows that health means the number one thing for the life. So basic Ayurveda preventive measures emphasize that dinacharya. So dinacharya means from morning to night, daily regimen they mention. So these are the things especially Ayurveda emphasize. Brahmamurti Uttishtate Rakshata Mayusham. That means Brahmamurta means early in the morning, before sunrise, 48 minutes earlier. That means around 4:30 to 5 o'clock. You have to wake up in the morning because you can get the fresh oxygen. You can your internal enzymes and all this internally it is activated. So lot of benefits are there. You can get lot of benefits if you can wake up early in the morning. But nowadays I think in the society that forget. And after that you can get the Ushapana. Ushapana means you have to drink lukewarm water. So that also very beneficial because your this elemental canal it is open. So with that you can your inside can activate properly. So Dantadhavana, normally everyone knows how to brush your teeth, but long ago we used herbal sticks for that. There are so many herbal sticks. Nowadays it is replaced by toothbrush. So daily exercise, it is called Vyayama, and so physical exercises, especially yoga we can do. Nowadays very important because non-communicable diseases as well as communicable diseases because of this not doing daily exercises, it is very common in our societies. So daily eating habits also must be very important. Build healthy eating habits, eat a variety of vegetables. In Ayurveda it is called as Annapana Vidhi. Eating, how to eat, how to get the amount and some lot of details included in this Ayurveda. So this is not just a method of medicine, it is a lifestyle. And have a big, deep philosophy also. So water and fruit consumption also very important. The recommendation of fruit and vegetables intake at least 400 grams per day, or 5 servings of 80 grams. Daily having a bath also very good. And in general rule, Ayurveda advises to use hot water on the body and cold water for the head. Ayurveda opens that having hot water head bath is bad for the eyes and hair. Sleep. And these days for sleep also, a lot of people having problems in sleep, insomnia. It is called insomnia. So sleeping in the time is at least more than 6 hours, 6 to 8 hours. It is very good for the body. So sleeping can do your restructure in the body. So it is very essential for the person. Yoga and meditation also you can do further. And Ayurveda treatment techniques are, there are a lot of Ayurvedic treatment techniques here. So I will describe one by one. Shiro Abhyanga. Shiro Abhyanga means head massage therapy. It is very important because if you are having not only for the headache, not only for the hair problems, but also with the for eyes, ears and nose, every panchendriyas you can activate. At the same time you can't get any nervous system disorders if you are doing oil treatments normally for day-to-day life. And Sarvanga Abhyanga means body treatment, full body treatment. It is also very good for stimulating internal body organs. So it is very, you can get the healthier life if you can do that at least once a week. So Shirodhara is very special head treatment. This is mentioned by the first picture. Shirodhara, we are pouring blood oil, proper oil. That depends according to the patient. We can select the oil and we are pouring that into the, here it is called third eye. It is a marma point of ours. So we are stimulating that point. By that, even we can treat paralyzed patient. They can walk after that cerebral vascular accident, paralyzed. After doing this, but not enough one time, at least 7, 14 like that. We have to decide according to the patient's disability. So Shirohasti, that also had the radiation therapy, the second picture shows you. It is especially for the insomnia people and especially psychological problems and a lot of things you can get, you can treat with this fourth one. And Padabhanga means foot bath. It is good for the wound healing like that. And Pada in the foot, in the foot, we can have all the internal body organs. You can foot and palm and here. You can get all the marker points here. It resembles into the internal body organs. So if we touching this palm or foot, it is very good. We can stimulate that internal body organs and do the proper circulation and proper enzyme secretions, hormones like that. So you can get healthy after doing this Pada Abhyanga. Vakra Abhyanga means face massage. That also very good for the facial complexion. And Avadaha said the herbal bath that is called Betorua. Very, very important for the full body treatment. It is very good. Even paralyzed patients, even lot of disabled patients, we can get that treatment. Herbal bath and flower bath also. Vashpuseta means steam inhalation. This is the third picture. It is unique to Ayurvedic medicine. As well as just like Shirodhara, it is unique. These treatments are unique to Ayurvedic medicine. Normal steam bath you can get from a steam room or whatever, but this one only for the body, not for the head, and because as I mentioned, for the hair and eyes, it is we need cool ingredients, not the heat ingredients. So that's why this apparatus in Ayurveda, it is very good treatment for the whole body because all the impurities comes out after doing that. And Shirodhara means milk pouring treatment. We are pouring milk to the body. So it is with the herbal we are doing that. It is also very good for the complexion. We can improve the complexion. And Kashayadara means pouring decoction. That also very effective. This is again Panchakarma treatment. Panchakarma means Vamana Vireka Nasya Vasti Rakta Moksha. Again I remind you. Special Ayurvedic treatment.
Time is up. Can you just wind up this with the short, very short?
Yes. This Pindaseda means milk rice fermentation by using milk rice. It is also very beneficial to the body. And especially Udvartana means body scrub, herbal body scrub powder. And there are so many other treatments also. Kati Vasti means the last one. It is good for the low back pain. It is very beneficial to the low back pain. Nowadays, a lot of people are having low back pain due to using these laptops and other apparatus. So, conclusion and my suggestions are enhancement of Vyadhishamatva. It is essential to keep a healthy life. To increase Vyadhishamatva, someone needs to follow daily regimens as mentioned in Ayurveda. Ayurvedic medicine plays a great role in rejuvenation. So Ayurveda treatment techniques are unique and natural as it is promote positive health. By using these treatments, almost every organ of the body gets beneficial. These are the references of mine, and thank you very much for here.
Thank you. So this is the kind of a literature survey study that you have done, is it? So as a part of the curriculum that you will do, or this is out of your interest?
We are doing these things according to the patient's complaint, and after our diagnosis, we can select these treatments and do.
Okay, now I mean that you are referring these chapters and then again you are the work on
Because
this.
these
Yeah.
are some of these treatments are very popular, but other treatments are very rarely used.
Okay, so how are you diagnosing the diseases?
It is a big thing because
But-
we have Dakshara Pariksha, like that we can get more details from the patient and we can observe the patient's thin body parts and all this. After that we can diagnose his disease. After that, according to that disease, we are selecting.
I want to clarify the one sentence that you referred, that you said that we have hot water baths and all that will not good for the head and the eye, but for the body it is good. So can you explain it why, like, because when you have a bath it's not practical. So we have to have a bath, otherwise we have to put a cold water on this thing and then hot water in the body and the cold water on the head. So it's not practical. So and also mixing both the thing also like as a
Then you can use lukewarm. That means very
low warm water.
temperature.
Yeah.
For the body, you can take.
Yeah. What is can you tell some explanation, because just saying that not good. So why what's why what is why it shouldn't be?
Because it is we have air in the head. We have air. So air also plant just like a tree. So that if we
The
just
temperature
take that if we are putting hot water to the roots of the
Okay.
tree, it is not good. So that's why we are telling that you have to put to the scalp oil. Then it is good for the hair. Yeah. So
Yeah,
like that
those
and,
days traditionally the people they apply the oil, no, without apply it's not good. That's what the earlier people they say. But nowadays people are not using. Even now they use the
that's
other
why we
gels,
can-
gel and all.
That's why we don't have enough
Hairs
hair
on
volume
the-
and thickness. Even Shirodara, we can get a good volume of hair and thickness and gray hair disappear. And lot of and you must not forget that under the hair we have that the most important organ in our body, brain. We are doing these things to stimulate the brain. Actually, that is the most important thing because brain needs stress, removing stress, releasing, relaxation. That is very very important because nowadays, according to this COVID situation, pandemic situation also, lot of people died not because of COVID problem, but because of non-communicable diseases such as because of stress. So relaxation techniques are very important in these days nowadays. Thank you.
Thank you so much. Thank you so much. So our next presenter, which is going to be the last presenter for this session, evening session, Philly Deva from the University of Colombo. It's going to present about the prevalence and the associated factor for the low back pain among professional bus drivers.
a big study where we conducted the prevalence, the factors that relate to the causation of lower back pain in functional bus drivers, both mechanical and psychological. So earlier I discussed the psychological factors related to the prevalence of lower back pain among this particular group. Now I wish to discuss the mechanical and the biological factors that lead to higher prevalence of lower back pain within functional bus drivers. So, as I mentioned earlier, the studies have found that bus drivers have a very high prevalence of lower back pain. So, keeping that in mind, the study question was designed to assess the prevalence and associated factors for lower back pain and other lower back related symptoms, meaning lower back stiffness and lower back tenderness among professional bus drivers. So this study assessed the prevalence of lower back pain and social demographic factors, work related factors and health related factors for lower back pain was also analyzed. So according to previous studies, it has been identified that 40 to 60% of the global working adult population suffer from lower back pain in Western settings. This study was conducted in Western settings and they are talking about the global population. So it has also been found that the lower back pain prevalence is higher in low income countries than in high income countries. In a Western setting, a prevalence of lower back pain is found to be 81% in bus drivers, 60% in truck drivers, and 51% in taxi drivers. It was identified that lower back pain causes increased healthcare costs, sick leave, individual suffering, hospitalization, and it also affects the productivity and efficiency of the drivers. So all these studies were conducted in Western settings, and data on South Asian or Sri Lankan population on the current topic was not really common. So based on these, I would like to identify the prevalence of lower back pain and its effect on improving the productivity and reducing the direct and indirect costs of lower back pain related symptoms. So the study followed the same study method with the analytical cross-sectional study design and 140 participants, out of whom 77 were long-distance drivers and 63 were short-distance bus drivers. The study tool of individual administrative questionnaire collected data regarding the social demographic background, the driving distance and duration, the employment duration, and the data regarding back pain, its duration, and any other lower back related symptoms. So the study found that the sample was between 20 to 58 years of age, and 120 were married, and 97 had the highest education qualification listed as GCE O-level examination. The highest distance they drove, a person drove within the sample, was 405 kilometers, and the lowest distance was 6 kilometers per trip. So they completed this trip within a day of their working schedule. And the average distance for the participants was 116 kilometers, and long distance drivers, 55% of the samples were long distance drivers, completed to average of 230 kilometers per day, and short distance drivers completed an average of 28 kilometers per day. The average employment duration of a participant was 12 years, and they had a driving time between 50 to 100 hours per week. So the study found the prevalence of lower back pain to be 40.7%, stiffness to be 27.1%, and tenderness to be 17.9%. The study also found the lower back pain in this sample directly affected their productivity and efficiency, with 7.9% having to change their daily duty shifts. 12.9% having to change their professional, personal and leisure activities due to their back pain, and 18.6% seeking medical treatment, and 2.9% actually having to be hospitalized due to lower back pain and its related symptoms. Study also found a statistically significant relationship between age and number of driving hours per day with the presence of lower back pain. So as I mentioned in my earlier presentation also, the prevalence rates, although they were different from Western settings, they were in line with previous Sri Lankan setting prevalences. And the study also found the most highest risk group were above 40 years of age for a high prevalence of lower back pain. This might be due to the age-related changes and degenerative changes in the lower back that makes it more prone for pain and symptoms. Also in line with previous studies, we found that with longer hours of driving, you get a higher prevalence in lower back pain. This might be due to the prolonged exposure to vibration and prolonged correction. The position that they sort of have is the cramped position while they're driving. So in conclusion, awareness programs for bus drivers to improve their back discipline and posture correction would be advisable, and relevant referrals for treatment for existing lower back pain issues could also be carried out, and suitable exercise programs for posture correction can also be introduced to the bus drivers. And based on these findings, I would like to suggest making the steering wheels and riding seats more adjustable on public transportation buses, and introducing screening tests to identify lower back pain using the mandatory medical examination for professional bus drivers.
Any questions? Thank you. Any questions? Any suggestions?
You are suggesting something and for the benefit of the drivers and things. So how do you think that this message will reach them, and publishing here it is enough for?
Actually, we were hoping to go for a bigger sample and an island-wide study, because this is just a 140 sample and it might not really give a generalized picture. So if we get a big enough sample and we reproduce the same results, we were hoping that results would sort of influence the decision makers to make.
You have to make a publicity on this.
Yes.
Okay. Thank you.
Out of my curiosity, so why this study is about back pain? So you are working on a physiotherapy unit, is it?
Yes, this was earlier a part of my occupational health postgraduate. So I wanted to introduce an intervention with the given prevalences. So I'm still working on that part of the study.
Since yes, you have done the physiotherapy degree,
Yes.
so I can ask some questions. So do you all have any way of reducing the pain like any other gadget, or some mechanism, if you can find some equipment, some law to introduce
Yes,
something?
we do, but here I was actually trying to focus on something they can do it at home rather than just visiting a physiotherapy department, because that's not really practical for them to keep going back and forth. The target was to develop a simple exercise program that would correct their posture and improve their lower back strength, so that the pain reduces over time. You can say 6 weeks or so.
Yeah. You can provide consultations.
And also nowadays they are using these IRAs also.
Yes, we use IR, short wave, and depending on the symptoms, we also use stimulation therapy.
Thank you so much.
Thank you.
Let's come to an end for this oral presentation, and then again we are going to have 3 more poster presentations there. So I would suggest all of you to go around and then again please have a look at their posters, and if you have any questions, then again the poster presenter will answer your questions, right? So So please stay here, because after that ceremony, after that we are going to have this the closing ceremony, right? And after that there will be a tea break also. So please stick around, and then again I wish that, I think there are supposed to be 3 posters, right? Irene and Fatima Shirafa and St. Vinny's. Yes, yeah. So there are 3 posters supposed to be there, and then again please go around and then again view their posters and ask some questions, and maybe give them suggestions. So with that,
So thank you very much for being here, because the all sort of presentation we were able to listen Ayurvedic, antibacterial, so many things like pollen people, pregnancy, eye matters and all. It's really interesting, and congratulations for all of you all. So then with that, the poster presentation, I think now we can wind up the session, right? Thank you. You all can take a photograph here to the poster, and then that is presented. How did you test the I think paper presented also something similar. But different percent. Same support. So what is the difference? Because what is the 8 figures means what?
What happens is it affects the elderly in a different way. Such as, for example, technology. If you take technology, youngsters are more familiar with technology, but the old people are, most of them are. So we have seen an person in the technology, and some people have found their life with more anxiety, stress, and depression due to the use technology to their daily tasks, like paying bills, buying food.
They are confined to the or they are working crowd and stuff like in 65 there are some people working crowd also.
People are confined to their houses, as this was done during the height of COVID, and COVID was.
And what are the situations that they have used online investigation or possible?
When COVID was at its height, most people had to order stuff using apps and online services. They couldn't travel to
Most of the we all people together with the youngsters.
that is why we asked if they live with their families or not. And I've come to view that 29%
That you have taken the sample out of the
random sample, and
maybe with the family or may not.
we asked for that. So they
going live.
with their families, but then almost 70% of them without family. And they had the independent income.
No, Nick? No.
Yeah, when you are in front of this, yeah, live, Facebook live. Oh my God, can you believe it?
It's live.
No, I think it's live.
Yeah.
It's talking about.
I'll give you a number. We can call just yeah, it's going on. Someone watching. Someone watching my cake.
I think I must have done something.
You know, they show your
Thank you so much. This one, will you upload it on the website? No, it's already because I didn't know. We three of us, we were staying in front of this. We were talking. You had to cut that. And then again, I didn't know because I was showing this. And then again, I think it must have shown.
We can now